So unfortunately, as we know, lop-eared problems exist greatly among lop-eared rabbits. Most lop-eared rabbits have problems with their ears, or will have at some point in their life. It used to be that we would say with a lop-eared rabbit that if they get an ear abscess, now we say when they are going to get an ear abscess. It is pretty much definite that the rabbit is going to at some point go through ear troubles and an ear abscess. So it's really, really important to be vigilant with your lop-eared rabbits and what to check for. Sadly, over the last few weeks we've taken... So this is Bolero. He arrived to the rescue and it was quite evident very quickly that he has issues with his ears. This does often go undiagnosed and unnoticed in rabbits. I am never sure why, because it is very, very clear and easy to tell once you know what to look for. So it's really important that you do know what to look for. So today I'm just going to show you a quick example of when you have a lop-eared rabbit, what you should be doing every single week, if not more so, to check your rabbit's ears. And you should check between the base of the ear and the corner of the eye. So between the corner of the eye and the base of the ear, this connects to the jaw. Here is where you will find ear lumps, abscesses and wax build-up. A rabbit's ear canal is very long and the wax builds up inside. The problem that lop-eared rabbits have is they cannot get ventilation into their ears. When they cannot get ventilation, they cannot disperse the wax that naturally builds up within the rabbit's ear canal. So the wax penetrates deeper and deeper into the ear canal until eventually it either forms an abscess or it turns into middle ear disease, which is very, very serious for rabbits. So you should be checking between the base of the ear and the eye. You should be palpating that regularly. He's not very happy at all because it is very, very painful. This poor little guy has a severe, very, very severe ear abscess. It is very, very bad and he is receiving treatment with the Royal Dick Vet School for that. But what we'll do is we'll show the difference in his two ears. So this ear is nice and flush. It's nice and flat. There is no lumps. If you push in gently at the bottom, you can feel some nice soft cartilage. There is a tiny little bit of wax that we can see with the otoscope, but we cannot feel anything there. That's normal. If we check his other side, if we feel between the eye and the base of the ear, has a massive lump. This has developed to the point of being very severe. So he now has about the size of a 50p piece large lump here. You can see it pushing through. It is very, very hard. It will start off very soft and it will be able to be gently palpated and pushed in. His is now at the point where it's extremely hard and extremely painful, and he is in a lot of pain when you touch him, which is a shame. He is on pain relief at the moment. So this is where you should be checking, and this here is the large lump. So you should be checking every week the bottom of your rabbit's ears. You should be lifting their ears up, you should be stroking them, you should be feeling between the eye and the base of the ear for any lumps or any nodules or any wax build-up. If you do have this, you need to have your rabbit seen by an exotic vet immediately. The rabbit's ears can be flushed. The rabbit's ears can quickly develop into things like facial paralysis, which this little guy has. That's when the abscess is pushing on the nerves of the face and causing the face to pull up on one side. It can cause head tilts, it can cause total paralysis of the head and neck, and a whole host of other issues. It is really, really important that it is seen to right away. And actually with lop-eared rabbits, prevention is better than cure. So you should be checking regularly the ears, you should be feeling for any wax build-up. You should be having your lop-eared rabbits checked by an exotic vet every 4 to 6 months to have their ears checked inside with a deep nose otoscope, and you should be applying ear drops if your rabbit has an issue with wax build-up. And if they do, that will require surgery. So they will have to have potentially one, if not multiple surgeries throughout their life, which is obviously risky for a rabbit. And they will have to see an exotic specialist. This cannot be done by any standard regular town vet. These are very specific and complex issues, and they have to be seen by a recognised rabbit professional vet.